Instagram, what is up? We are back for another episode of the Wilderness Fitness Podcast. I'm your host, Dr. Rob Minturn. Thank you for tuning in tonight. A beautiful Friday evening. I'm here in Fargo. A buddy's getting married this weekend, so I'm doing the podcast tonight from the Airbnb that we're renting here for the guys' weekend. Anyway, tonight I want to talk to you guys about choosing the right surgeon and how to go about that. There's a few aspects that I want to talk about, but before that, some housekeeping stuff. We've got Spicy Saturday tomorrow, so I'm going to run through that workout real quick. And I actually just recorded the goal seminar for the Spike Camp membership, and thank you to those for tuning in tonight for the seminar. That will be uploaded to the Spike Camp membership. So if you guys are interested in watching that seminar, go ahead and go to the website. It's under the Spike Camp membership. It's $24 a year. So you watch one seminar, you pretty much pay for the membership. Anyway, let's get to the workout. So for Spicy Saturday, we've got an EMOM, so every minute on the minute, every 30 seconds, you're going to do one clean and jerk. You're going to do that for 20 minutes. The RX for the males is going to be 185. The RX for the females is going to be 115. For the skilled movement, you're going to perform every minute instead of every 30 seconds. And then you're going to do, if you want to do the clean and jerk, every minute instead of every 30 seconds, that's a way to scale it. If you want to change up the movement, you can do a deadlift or a clean without the jerk. So you've got a few different ways to scale there. You can dial back the frequency, so every minute instead of every 30 seconds. You can add variation with the movement that you do. And then you can also reduce the weight. For the men, for the scaled movement, it's going to be 135, and then for the ladies, it's going to be 95 pounds. If you guys have any questions, let me know about the workout. Justin is the one that programmed it, so if you guys hate it, don't blame me. If you guys love it, let Justin know. All right, so choosing the right surgeon. So with that, there's some things that you've got to know before going into it. You're probably not going to hear about it from the surgeon themselves. Majority of their time spent with you, I'm just going to be frank, the majority of the time spent with you as a surgeon is usually when you're passed out. So they see you for the pre-op, they see you for the post-op stuff, but sessions are anywhere from 5 minutes to 15 minutes tops with your surgeon, with the surgery taking anywhere from a half an hour to maybe 2 or 3 hours. So it just depends on what you're having done. So the majority of the time that your surgeon sees you, you are completely knocked out, comatose. You've got a breathing tube. You are in La La Land. With that, we don't live with the ailment, you do. So you're going to have surgery. You're going to have to go through therapy. If it's an orthopedic surgery, you're likely going to have to do some sort of therapy. You're going to have to recover from the surgery. You need to do your research. You need to do your due diligence for yourself because no one else is going to do it for you on the surgeon that you're choosing to make sure that their outcomes are consistent. So there are two ways to really go about that. Talk with friends, talk with family. If you don't have a ton of people that are doing or that have had surgeries done, you can also call local therapy clinics. The reason I say call local therapy clinics is because we're the ones that get to see the patients the most often after surgery. We don't see them like the surgeons do at the before and at the after. We get to see them at the during. So we get to see what the symptoms are like. We get to see the ebbs and flows. We get to see the trajectories that the patient is on. Is it a very consistent upward direction, or is it a very up and down, like it's a very inconsistent trajectory with their path to recovery? So do yourself a favor, call the local therapy clinics because you're likely going to be having therapy in the local area, and see who they would recommend for their mom, their dad, their grandparents to go to as a surgeon. If someone asks me in the clinic and they already have a surgery scheduled with a surgeon, I'm probably not going to make a recommendation against that surgeon just because it's not a great look. If they do ask me my opinion, I will be honest with them and give them my opinion about that surgeon. As a traveler, it takes a little bit to figure out the consistencies as far as who's a solid surgeon in the area. If I'm new, I will just ask the other therapist who they recommend. But definitely call the local therapy clinics, call multiple clinics so that way you get a bigger sample size. It's only going to be in your benefit that you get a bigger sample size as far as the recommendation goes. The other thing I want to talk about is don't be afraid to drive to the best surgeon. It is the rest of your life. If you're having a rotator cuff repair on one of your shoulders and that goes bad, that goes south, you're going to have to deal with that for the rest of your life, or you're going to have another surgery by a different surgeon. And in that case, you're likely driving to the best surgeon already. So do yourself a favor on the first surgery. Don't be afraid to drive to the best. I always say there's a surgeon when I've got patients that are considering, like they've got two different surgeons in mind. One's local, one they have to drive a little bit. I always recommend go to the one that you are going to be happy with. Don't go to the one that's most convenient. I always tell them there's a surgeon out in California, in Fresno, California, that I would 100% find a way to have him do my surgery if I needed a rotator cuff done or a ACL reconstruction done, just because his outcomes were the most consistent and, in my opinion, the best and the quickest out of most of the surgeons that I've seen as a traveler working throughout the country. So don't be afraid to drive to the best. Obviously, it's got to be realistic, but don't let distance be the reason why you don't go down to that person. You've got to make sure that you're doing what's best for you in the long term. Another thing that I'll get asked is, when is it time for surgery? My answer to that is usually when the impairment is affecting your activity level by probably a third, either a quarter or a third. When someone goes in and has an x-ray, or someone goes in and has an MRI, if someone on an x-ray has bone on bone, that does not necessarily mean that they're going to have a knee replacement done or hip replacement done. I've worked with plenty of folks that their x-ray looks absolutely horrible. I've actually got a guy in caseload right now, like I can hear his knees kind of clanking back and forth. Absolutely no pain. He's able to do deadlifts, squats, step ups, step downs. He was doing them a little too frequently, so they started to aggravate his knee, had him back off a little bit. That took away the aggravation. He's doing just fine. He's actually considering going out and hunting again. The dude is, I think, 78, and he's considering going out to the woods again after taking a couple of years off. So just because his x-ray showed up as bone and bone, he's not having much for pain. He's able to do everything pretty much that he wants to do, even though it sounds and looks very bad. If his activity level got limited by about a third, that would be a reason to maybe think about going down the surgery route, because you're not getting any younger. You're only going to get weaker if it's really affecting your ability to get around. So you've got to take that stuff into consideration. If it's inevitable, why are you putting it off? That might be a time to get it done, so that way you don't continue to get weaker. You get older, you maybe put on some weight. It's just going to make the rehab a little bit harder. So I am pro-surgery when I think it's appropriate to allow the person to return to the quality of life that they want to live. With it limiting your activity by a third, the other question that you've got to ask yourself is, have you changed your lifestyle and your modifying activities? Have you made the necessary changes that you're going to probably make after surgery anyway? Have you made that before surgery and given yourself a good shot to hopefully avoid surgery? There are inherent risks with surgery, infection, and things possibly going wrong components being used. Like, we're all humans, right? There's always a risk to human error. Anytime that you can avoid that, you want to. So have you made those changes in your life with your sleep schedule, with your nutrition? Have you made those necessary changes already to see if you can actually ward off the surgery, or is it something that you're waiting to have surgery to quote unquote fix you, and then you're going to make those changes? Because I guarantee you, if you're waiting for that to happen, you're going to make those short-term changes, then you're going to go back to doing the shit that you were doing before. So you've got to make those changes before you're having surgeries to see if you can actually ward it off. And then healing timelines. If you're looking at bone and you're sort of grinding to the bone where the surgeon goes in and cleans up the arthritis, you're looking at, depending on your age, but you're looking at 6 to 8 to 10, or 10 to 12 weeks, depending on your age. 10 to 12 weeks is usually like 60 and older. 8 to 10 weeks is you're looking at like 40 to 60. 6 to 8 weeks, you're looking at anybody younger than about 30 or 40. If you're looking at muscle, you're looking at 4 to 6, 6 to 8, or 8 to 10 weeks. With that, you've got to think about, you want to reframe your mindset of you're getting fixed. If you're having surgery, it's trauma to the area, whether it's rotator cuff repair, ACL reconstruction, total knee replacement, total hip replacement, back surgery. The bone has to heal, the muscles have to heal, the ligaments have to heal, all that stuff has to heal. So you've got to look at it. I always use the analogy of you got shot by a gun. If you got shot by a gun, would you expect to be doing this 2 weeks after getting shot by a gun? If not, then surgery is along the same lines. It's purposeful trauma, it's good trauma, but it's still trauma to the area. The body has to go through the healing timeline, in the healing cycle in order for you to progress on and continue to feel better and get back to doing what you were doing before. So again, it's a mindset shift. Have you changed your lifestyle habits? Would you expect yourself to be doing that 2 weeks after you got shot by a gun? If not, you've got to dial back those expectations just a little bit. If you guys have any questions about tips on choosing the right surgeon, let me know. Otherwise, you guys have a great night, and we'll catch you later. Hey, thank you for tuning in to the Wilderness Fitness Podcast. If you enjoyed this episode, please head over to your podcast app and consider leaving a review. If you think a friend or a family member may benefit from listening to this podcast, please consider sharing this episode with them. We appreciate your help in the growth of this podcast. Check us out on Facebook and Instagram for even more content and the weekly Hump Day Q&A, where you can get all of your human performance, rehab, women's health, and injury prevention questions answered. If you're interested in getting hooked up with even more content from Wilderness PT from the comfort of your own home, head over to wildernessphysicaltherapy.com and get signed up for the Spike Camp membership. This is where you'll have access to prior seminars and a workout that'll have you in shape each fall, designed by yours truly. Since you're there, check out the mid-month media newsletter that goes out 1 to 2 times a month, which includes a variety of topics with the most recent research on health and human performance. You can sign up by hovering over the free resources section and subscribe to any of the free guides, or simply sign up under the mid-month media newsletter tab.